Hi, my name's Anne-Marie Graham-Hudak. I'm your Canton Township Supervisor, and welcome to Good Day Canton. Today we have a guest from Growthworks, Laura Reiners, the Community Relations Director. So welcome, Laura. I'm glad to have you here. Could you tell us a little bit about Growthworks?
Sure. So Growthworks is a human service organization. Our main office is in downtown Plymouth, but we serve Wayne County and primarily the Conference of Western Wayne, so those 18 out counties of Wayne County. And we provide substance use treatment, juvenile justice and case management services, family services, and some other mental health and trauma-related services to support the needs of the community.
How long has Growthworks been around in the area?
So Growthworks started 51 years it'll be this year. So in 1971, our founder was kind of tasked with being able to get some of the youth, the at-risk youth in the community that were getting into trouble and having a constructive way for them to spend their time. And over time, we've developed substance use treatment, other resources for those kids, and a number of other resources to just meet the needs of the community. And I think that's why we've been around for so long, is because we've been able to evolve and meet those different needs.
Okay, now how do you work with other organizations in the area?
That's a good question. So really our biggest goal is how do we make sure that residents and community members know how to access our services? So that's kind of what drives the partnerships that we strive. So including you in the township, the police departments, fire departments, hospitals, and healthcare facilities, as well as schools are the primary entities that we're trying to reach and let them know about our services, because it's those first care, or there's those providers, those teachers that are having interactions with those kids and families that can help direct them to our servicers and make sure that they know that they're available.
Great. Now I know that for a while it seemed like you lean more towards substance abuse. Is that still the case? And what is the percentages of that?
I would say that that's probably what most people know us for, is our substance use treatment, because that's a lot of what our services stem around, and that's how we originated. But I think that it was really back in the 90s when we saw a lot of the kids we were interacting with, that a lot of those kids who were dealing with substance use issues, that they were also interacting in the juvenile justice system or getting in trouble. So that's what kind of took us in that direction. So I would say that it's, probably more than 50%, if not more, of the individuals, even if they're in our other programs, are dealing with some sort of substance-related issue. Because when you're seeing issues in the family, kids that are getting into trouble, substance use is frequently at the root of those. So even while we may have people in other service lines that Growthworks offers, a number of them are seeing us for substance-related issues.
Now I know you also work with the Conference of Western Wayne. What is your contract with them on?
So we work with them on a number of different ways. One of the big areas is our peer recovery coaching program, or Rescue Recovery. We were able to work with the Conference of Western Wayne to get a considerable amount of state funding to be able to provide peer recovery coaches. So these are individuals who are in recovery themselves, and they go out and they meet with individuals at the fire departments, police departments, and the hospital, and help people who are in active addiction, who've hit that rock bottom moment and they want to get help. They want to say, hey, I want to work with somebody who's been in my shoes, because that's where the peers have been, and help them on that road to recovery. So that's one of the areas that we serve all the communities in the Conference of Western Wayne through that funding. We also provide youth assistance services. So these are for some kids that parents or teachers or police officers can kind of see that these kids are starting to go down the wrong path, but they maybe haven't committed as serious of offenses yet. And they can come to Growthworks for some life skills. Sometimes it's substance use related issues, and see us from anywhere from 3 months, 6 months, and be able to get some supportive services and really do a thorough assessment of, like, what are some of the issues these kids are dealing with and how can we best support them. And that's something that's also available to all the communities in the Conference of Western Wayne. So we're proud to provide those services.
What do you think your clientele is? Mostly youth or adults, or what do you find with that?
I think primarily it's youth. And while we're more than happy to provide our services to anybody who needs them, we're seeing that the services are needed in the schools at a younger and younger age. We're seeing kids that are starting vaping and smoking younger than 10 years old, if you can believe that. So the earlier that we're able to get in front of these kids, provide resources to the families to be able to provide these healthy behaviors, even just what does it look like to have a strong family unit? How do mom and dad set a good example in the home? And how does that stem into all these other areas that we're able to support families? So yes, we're trying to get as many partnerships with schools, and we've actually started a new program with St. Mary's and a few other communities. We've hired a suicide prevention coordinator, because that's something that also has been on the rise. And that goal of that committee is to have 0 committed suicides in the Western Wayne School District. So we've hired a coordinator who's got a background in school and education who can work with all the different school districts and seeing some of the different things that they're individually doing in the schools to help reduce suicide. And then how can we expand those and provide more training and other services and other things across the whole region.
Okay, now, do you know, I was told the other day that the Wayne County Mental Health, I didn't know this, that they have funding to supply social workers to all the different schools. So, you know, even partnerships like that would help because you could partner with those funds.
Yes, I think, and I think none of us is unaware of everything that's been going on over the last few years and the changes. And I think that's been one of the biggest struggles for a lot of the youth in the community is when they're not going to school, when we had some virtual care, other virtual services, or just a lot of the opportunities for kids to interact with other kids and adults, that's where we've seen a lot of these issues that we deal with just continue to rise, the substance use and other issues that kids get into. So more opportunities to have social workers, other trained and caring adults that are looking at these kids and saying, what are some of the things you're struggling with? Are there issues going on at home? And then how can we provide these resources and these interventions? Because I think that's one of the hardest parts of my job, and one of the things I'm trying to change is when you see a family or you see a kid that's struggling and they're to the point where they're asking for help and they don't know where to turn or they can't get in touch with our services. So that's where I'm on a mission to get out as many brochures, and as many conversations like this, so that people in our community do know that these services are available to them, and how do we reduce any barriers to being able to help them access services.
Yes, and it you know, a lot of people, we've had health issues and mental health issues increase substantially in just Canton over the past year, 43%. You know, our police officers, where the stops are going into homes. And just myself personally, you know, a lot of people thought, oh, it's somebody else, but myself, you know, our own home and our family members, we've had overdoses and deaths and suicides, and so it's not unusual for all families to be touched by this.
Exactly. It's not something that's a positive thing, but in some ways it is that this affects everybody. This is not biased in who it affects. So especially when we're an organization that is seeking out different funding opportunities at the county and the state level, it is something that does go across the aisle, and it is something that has affected just about every family in one way or another, someone in the juvenile justice system or the justice system as a whole, or substance use. So I think that's a positive thing in the sense that it's a way to unify us. Instead of looking at all the ways that we're different or some of the different policy discrepancies, that it's like, look, this has affected everybody. How do we get at the root of the problem and try to start working on solutions?
Now, you had touched a little bit about COVID. How else has COVID affected what you think the mental health in terms of isolation, but other ways in terms of just being able to get people health?
Yeah, I think that definitely it's affected us. I mean, we are just such a human service organization, and being able to meet with you like this is very different than having a phone call or having Zoom. Now, we're very lucky that we've been able to embrace a lot of those virtual technologies, but it prohibited or it prevented us from getting in touch with a lot of our clients. Now, we've been creative and found new ways, particularly early on, almost 2 years ago, when we were able to provide a lot of services virtually. We had staff members that were doing drive-bys and going up to their clients' homes and staying 6 feet apart just so that we could check on people. But luckily, I'd say for the most part, that we've resumed a lot of our normal operations. We've continued some of our virtual technology, and I think that that's been beneficial because there are still a lot of barriers that even as much as we've resumed normal activities, we know a lot of our clients that they're still struggling, that some of them have different comfort levels in terms of how much they want to socialize in the community, or they're immunocompromised. So I think it's broadened our perspective in terms of how do we serve our clients? How do we find new and creative ways to help them in the different areas that they're struggling? But it's promising. I think we're moving in the right direction. And I know I hear a lot of people say, it's like, well, we got to get back to normal. I don't think we're going to be going back to how things were, but it's how do we keep striving for that new normal, or how do things look in the future, and how can we continue to embrace that?
Now, why did you get into this business? What made you decide to go work for Growthworks?
So my background is in hospital administration, and that's actually how I got connected to Growthworks. As I was at St. Mary's in Livonia, I was working in business development, some of their different new projects and opportunities, and that's how I got introduced to Growthworks, because like I said, they've been in the community for a long time. They've partnered with the hospital, but it was when they were pitching their peer recovery coaching program. That was not at the height, but there were very intense numbers for the opioid crisis, and just the number of deaths was staggering. So some of the folks from Growthworks, and I actually believe some individuals from the Canton community and the police department, that they were very supportive of that initial program, and saying, how can we bring these coaches to the hospital? How can we provide an additional resources to individuals who are struggling with addiction? And so I was a part of that original team that brought the peer recovery coaches to the hospital. And it was through that I got to learn more about the Growthworks mission, all the work that they're doing in the hospital, even beyond the work in the substance use. And when I was looking for a change in my career, I really felt drawn to their mission. And I thought that I could play a role and help share that mission with other people in the community. And I'm so privileged to get to do that.
Great. Now, Canton is a very diverse community. I know you cover a lot of area with Growthworks, and Canton, we are very diverse.
Yes.
And we go through diversity training because we have residents that we have to interact with. And there are cultures that are more, they don't like to talk about things more. They like to keep it in the family, which, can sometimes work, sometimes doesn't. So how is Growthworks working with to make sure that they look at all of those cultures and residents and how they interact with them?
That's a great point. And I think that it's something that we've always tried to work on, but I think especially in the last few years, it's been something that's been much more of a priority for us. I'm proud to say that we have a diverse and even more diversifying in our staff and our leadership team across several demographics. But I think a lot of it just has to do with some of our Growthworks values in terms of our empathy for everybody that we interact with, regardless of their situation and what they're going through, as well as humility. I think that really grounds a lot of our staff and just how they interact with clients, no matter what their background, no matter what they're experiencing. And I think that goes a long way. I think that we're still trying to do whatever we can to help educate ourselves, educate our staff. Because while I may have grown up in a certain community and practiced certain traditions and certain norms in my community, that's very different than the people that are around us. So I think that's another one of those areas where we look to partner with other organizations and other strongholds in the communities, because we know that we don't have it all figured out and that we don't have all those resources. So when there are times that we can connect with different organizations that have that stronghold with those different populations and cultures in the community, we've definitely seen more success in that area as well.
Okay, great. Because now I know that we have a lot of organizations that we interface with, so I could even give you some of their names, because I think those partnerships are important because of all the different kinds of residents we have. Even when the police have a home that they have to go into, sometimes we have people that they'll call that'll go in and help them.
Well, and then they've already got that established relationship. And when I said we serve Wayne County in those 18 different communities, that's a large geographic area. And we have, we've got physical locations in Canton and Plymouth and in Garden City, but we don't always know as much of the different populations and some of those other entities. So we're always looking to partner with other organizations that have that relationship, so that we can build those relationships further.
That would be great. Now, if somebody wanted to get assistance from people with youth or so, how would they get in touch with you?
So we've got a lot of information on our website, a couple of different phone numbers, but probably the best thing is to just call, and that way we can do an intake or assessment to find out what services are best served for that individual or for that family member. Those are for the services that just anybody out in the community can call and say, hey, I'm interested in getting help with substance use, or my kid may be starting to struggle in school and I want to get them back on that path. There are other services that folks can access, like I said, through the police departments, the hospitals, or sometimes through the court system as well. But for anybody just out in the general public, I encourage them to check out the website and just call us, and we'd be more than happy to guide them to the best program.
Now, is there a cost for the service?
So most of our services are free of charge. Sometimes we have a minimal fee for either drug screenings or for when we have no-shows for appointments, because we are trying to increase that accountability. But for most of our services, there's not a fee, because we really want to make sure that all folks who generally would not be able to pay for these types of services, that they can get access to those services. So very few, if any, fees for most of our services.
Okay, great. Thank you. Is there anything else that you would like to say about Growthworks for our audience?
I think the biggest thing that I would want people to know is that to call and ask for help, that there is no shame in asking for help. Because I think that's the biggest challenge we're facing right now, is that shame and the stigma around the types of services that we provide. Like I said, it's so hard to hear that there are people that are out there that are looking for these services, but they feel that they don't want their next door neighbor to know that their kid is struggling. And then frankly, it gets to the point where it's it's much harder to help individuals. So that's part of my job too, is just the more people know that it's like, hey, I'm struggling with some of these things. I have people in my family that are as well, that I think that reduces that stigma and it makes it easier for people to ask for help. So that's what I would encourage people to ask for help and get the services that we're able to provide.
Okay. Thank you very much for joining us today in Good Day Canton. And it's really good information. And if anybody calls, because they can call the Township Hall and we can get a hold of you and make sure that you are aware of that. And I look forward to working with you more because I know there's a lot of help that's needed in the community and we have to have a strong front and close some of those gaps.
Yes. Well, thank you for having us here today. And we are more than happy and privileged to serve the community.
Thank you. Thank you, Laura. Thank you for joining us at Good Day Canton with Laura Reiners from Growthworks. And there's some great information out there, and you can call the Canton Township Hall or look at the Growthworks website if you need any information. But have a great day and stay healthy.